Hello to everyone. I'm very glad that you all are here, and I'm Dr. Jackson. I welcome you all. Today I'm going to give you an update about the coronavirus that is widely spreading. The coronavirus COVID-19 is affecting 210 countries and territories around the world, and 2 international conferences. The day is reset after midnight GMT plus 0. The list of countries and territories and their continental regional classification is based on the United Nations GeoShim. Learn more about Worldometer's COVID-19 data. Note: France reported that a portion of the PAD&M's nursing home cases, representing about 33% of the total PAD&M's cases, were confirmed rather than probable, as the other 67%, and as such are to be considered as already included in the total national case count. The French government has now started reporting the breakdown between confirmed and probable PAD&M's cases. We have adjusted the historical data for France from April 4th based on this information. In accordance with the decision by the French government to include PAD&M's probable deaths in the total death count, PAD&M's probable cases must be included in the total case count in order to be logically sound, as death implies a case, and methodologically consistent. On April 3rd, the French government had reported 17,827 additional cases and 532 additional deaths from nursing homes that had not been reported previously. On April 2nd, it had reported 884 additional deaths. 21 new cases in Cameroon, 89 new cases and 6 new deaths in Argentina, 539 new cases and 30 new deaths in Brazil, 578 new cases and 60 new deaths in Mexico, 1 new case in Eswatini, 27 new cases in China, 286 new cases and 4 new deaths in the United States. January timeline. On January 31st, the first 2 novel coronavirus cases in the UK 18, the first 2 cases in Russia 20, and the first case in Sweden and in Spain were reported. Canada reported its 4th case. On January 31st, the United States declared coronavirus a public health emergency. Issued 14 days quarantine rules for U.S. citizens entering the U.S. from China, mandatory if entering from the Hubei province. Issued an order to deny entry to foreigners who have traveled to China within the past 2 weeks. On January 30th, the novel coronavirus total case count surpassed that for SARS, which affected 8,096 people worldwide. On January 30th, the World Health Organization declared the coronavirus outbreak a global public health emergency. On January 30th, CDC confirmed the first U.S. case of human-to-human transmission. Germany, Japan, Vietnam and the United States have reported cases in patients who didn't personally visit China, but contracted the virus from someone else who had visited Wuhan, China. 15. These cases of human-to-human transmission are the most worrisome, according to the World Health Organization. Wuhan, the city where the virus originated, is the largest city in central China, with a population of over 11 million people. The city, on January 23rd, shut down transport links. Following Wuhan lockdown, the city of Huanggang was also placed in quarantine, and the city of Huzhou closed its train stations. This means that 18 million people have been placed in isolation. The World Health Organization, WHO, said cutting off a city as large as Wuhan is unprecedented in public health history, and praised China for its incredible commitment to isolate the virus and minimize the spread to other countries. Dr. Drake, you're welcome. Have a seat. Thanks. Is there anyone that have some things to say? Yes, of course. Go ahead, mister. 2020 coronavirus pandemic in Liberia. The 2019-20 coronavirus pandemic was confirmed to have reached Liberia in March 2020. On the 12th of January 2020, the World Health Organization, WHO, confirmed that a novel coronavirus was the cause of a respiratory illness in a cluster of people in Wuhan City, Hubei Province, China, which was reported to the WHO on the 31st of December 2019. The case fatality ratio for COVID-19 has been much lower than SARS of 2003, but the transmission has been significantly greater, with a significant total death toll. March 2020. On the 16th of March, the first case in Liberia was confirmed, a government official who traveled from Switzerland. President George Weah controversially named the person, and claimed they violated screening protocols at Roberts International Airport, RIA, in Harble. The second case was confirmed on the 17th of March, a close contact of the first case. Liberia's third case of COVID-19 was confirmed on the 20th of March. The third person was a returned traveler. Following this third case, the Ministry of Health and Social Welfare declared a national health emergency on the 22nd of March. On the 24th of March, neighboring Ivory Coast announced it closed land borders with Liberia and Guinea in a measure to contain COVID-19. On the 27th of March, the U.S. Embassy evacuated some U.S. citizens from Liberia. April 2020. On the 1st of April, the European Union organized a charter flight evacuating its citizens. Liberia reported its first death on the 4th of April. On the 7th of April, President George Weah appointed a new National Response Coordinator for the Executive Committee on Coronavirus. The committee will be headed by former mayor of the city of Monrovia, Madam Mary Bro. Some experts questioned Bro's ability to effectively coordinate the pandemic response given her inexperience in public health protocols. However, her appointment was noted to have been as a result of recommendations from the United Nations, particularly the World Health Organization. On the 8th of April, President George Weah declared lockdown measures to take effect on Friday, April 10th and last for 3 weeks, including suspension of all non-essential travel and curfews. The National Public Health Institute of Liberia, NPHI, recorded a record increase in the number of confirmed cases from 14 to 31, an increase of 17 new cases. They also reported one more death. Liberia was one of the first countries to start screening passengers for COVID-19 at airports. Schools were closed across the country, and churches, mosques, bars, and beaches in parts of the country. There has been controversy in the country over whether people with infections should be named. The National Public Health Institute of Liberia's policy was to not release names of people with infections to reduce stigmatization and protect privacy, but other government officials, President George Weah, Information Minister Lenny Jean Nag, have advocated for releasing names for better contact tracing. On the 18th of March 2020, China donated medical supplies to Liberia. 2020 coronavirus pandemic in Liberia. Disease COVID-19, virus strain SARS-CoV-2, location Liberia, first outbreak Wuhan, China, index case Margibi County, arrival date the 16th of March 2020, 1 month and 2 days, confirmed cases 76, recovered 7, deaths 7. Thanks, Dr. Drake. Dr. Jackson, how dangerous is the virus? There are 3 parameters to understand in order to assess the magnitude of the risk posed by this novel coronavirus. Transmission rate, RO, number of newly infected people from a single case fatality rate, CFR, percent of cases that result in death determine whether asymptomatic transmission is possible. How contagious is the Wuhan coronavirus? RO, the attack rate or transmissibility, how rapidly the disease spreads of a virus is indicated by its reproductive number, RO, pronounced R0 or R0, which represents the average number of people to which a single infected person will transmit the virus. WHO's estimated on January 23rd RO to be between 1.4 and 2.5. Other studies have estimated a RO between 3.6 and 4.0, and between 2.24 to 3.58. Preliminary studies had estimated RO to be between 1.5 and 3.5. An outbreak with a reproductive number of below 1 will gradually disappear. For comparison, the RO for the common flu is 1.3, and for SARS it was 2.0. RO, the attack rate or transmissibility, how rapidly the disease spreads of a virus is indicated by its reproductive number, RO, pronounced R0 or R0, which represents the average number of people to which a single infected person will transmit the virus. WHO's estimated on January 23rd RO to be between 1.4 and 2.5. Other studies have estimated a RO between 3.6 and 4.0, and between 2.24 to 3.58. Preliminary studies had estimated RO to be between 1.5 and 3.5. An outbreak with a reproductive number of below 1 will gradually disappear. For comparison, the RO for the common flu is 1.3, and for SARS it was 2.0. Fatality rate, case fatality ratio or CFR, of the Wuhan coronavirus. The novel coronavirus case fatality rate has been estimated at around 2% in the WHO press conference held on January 29, 2020. However, it noted that, without knowing how many were infected, It was too early to be able to put a percentage on the mortality rate figure. A prior estimate had put that number at 3%. Fatality rate can change as a virus can mutate, according to epidemiologists. For comparison, the case fatality rate for SARS was 10%, and for MERS 34%. How long it takes for symptoms to appear? COVID-19 coronavirus incubation period. Symptoms of COVID-19 may appear in as few as 2 days or as long as 14. Estimated ranges vary from 2-10 days, 2-14 days, and 10-14 days, see details, during which the virus is contagious, but the patient does not display any symptom. Asymptomatic transmission. Age and conditions of coronavirus cases. I'm going to give and explain on age, sex, demographics of COVID-19 cases and deaths according to early estimates by China's National Health Commission (NHC). About 80% of those who died were over the age of 60 and 75% of them had pre-existing health conditions such as cardiovascular diseases and diabetes. According to the WHO Situation Report No. 7 issued on January 27th, the median age of cases detected outside of China is 45 years, ranging from 2 to 74 years. 71% of cases were male. A study of 138 hospitalized patients with SIP found that the median age was 56 years, interquartile range 42-68, range 22-92 years, and 54.3% were men. The WHO, in its Mythbusters FAQs, addresses the question, does the new coronavirus affect older people, or are younger people also susceptible? By answering that, people of all ages can be infected by the novel coronavirus COVID-19. Older people, and people with pre-existing medical conditions such as asthma, diabetes, heart disease, appear to be more vulnerable to becoming severely ill with the virus. Patient who died in the Philippines was a 44-year-old mild patient who died in the Philippines on February 2nd, and what was the first death occurring outside of China was a 44-year-old Chinese man from Wuhan who was admitted on January 25th after experiencing fever, cough, and sore throat, before developing severe pneumonia. In the last few days, the patient was stable and showed signs of improvement. However, the condition of the patient deteriorated within his last 24 hours, resulting in his demise. According to the Philippine Department of Health, serious cases of 30-year-old patients in France as of January 29th. According to French authorities, the conditions of the two earliest Paris cases had worsened, and the patients were being treated in intensive care. According to French authorities, the patients have been described as a young couple aged 30 and 31 years old, both Chinese citizens from Wuhan who were asymptomatic when they arrived in Paris on January 18th. Age and sex of the first deaths is reported by the China National Health Commission (NHC). The NHC reported the details of the first 17 deaths up to 24 p.m. on January 22, 2020. The deaths included 13 males and 4 females. The median age of the deaths was 75, range 48-89 years. WHO Risk Assessment, Global Emergencies. Full details. WHO coronavirus updates on January 30th. The World Health Organization declared the coronavirus outbreak a global public health emergency. For more information from the WHO regarding novel coronavirus, WHO page on novel coronavirus 2019 COV. In comparisons, every year an estimated 290,000 to 650,000 people die in the world due to complications from seasonal influenza flu viruses. This figure corresponds to 795 to 1,781 deaths per day due to the seasonal flu. SARS, November 2002 to July 2003, was a coronavirus that originated from Beijing, China, spread to 29 countries, and resulted in 8,096 people infected with 774 deaths. Fatality rate of 9.6%. Considering that SARS ended up infecting 5,237 people in mainland China, Wuhan coronavirus surpassed SARS on January 29, 2020, when Chinese officials confirmed 5,974 cases of the novel coronavirus 2019 COV. 1 day later, on January 30, 2020, the novel coronavirus cases surpassed even the 8,096 cases worldwide, which were the final SARS count in 2003. MERS, in 2012, killed 858 people out of the 2,494 infected, fatality rate of 34.4%. Thanks for watching. You can count on us for more information. See you next time. Yes, don't forget to press that subscribe button.